The next topic in the topic of oral physiology, we will discuss about the physiology of mastication. The objective of our topic today are definition of chewing activity, describe the states of chewing, describe and analyze the characteristics of the chewing cycle, discuss and explain the neural control of chewing. So we will discuss about three contents. They are introduction to chewing activities, how does the chewing process occur, how is the neural control of chewing. About the introduction. Mastication or chewing is defined as the act of chewing food. Chewing is the first stage of digestion, when food is broken down into small pieces for easily swallowing. It is an activity that is generally automatic, but sometimes is consciously if you want. The model of chewing activities must ensure maximal efficiency with minimal energy consumption and avoid pain or discomfort through the precise control of chewing activities by neuromuscular system with protective neuromuscular reflexes, and the operation of lower jaw follows the type 3 lever principal mechanism, as well as the protective feature of dentition, especially the features of overlap, vertical overlap from the buccal, lingual, and distal sides between the upper and lower molar to avoid beating the tongue, lips, and cheek while chewing. To find out how chewing process works, we will discuss the following: stages of chewing process, chewing cycle, chewing force, and muscles related to chewing. When learning about the anatomical characteristics of teeth, we know that the anterior teeth is responsible for biting and tearing food, while the posterior teeth have the effect of crushing and grinding food, so that there are two main stages of chewing. They are cutting food and grinding food. When you eat something, the first thing you need to do is open your mouth and bite into the food to cut it. To do this, the lower jaw must be open and forward in an end-to-end position of incisor. Then the lower incisors slide over the lingual surface of the upper incisor in reductive movement and end in centric occlusion. This results of series of activities in cutting and tearing food into small pieces for grinding. With chewy food, the jaw will follow an anterolateral direction. It means the jaw moves forward with lateral side. So this process involves the canines in cutting. And this opening-closing movement of lower jaw is like the seizures. When the mouth opens, the distance between the incisors is larger than that between the posterior teeth, so it is suitable for functional requirements, that the cutting at the anterior teeth and grinding at posterior teeth. So what happens next to the food after it has been cut? After being cut, the tongue carries food to the back of the mouth and brings it onto the occlusal surface of the posterior teeth. The food is crushed, then grind into small pieces, mixed with the saliva to have a suitable consistency. The chewing in humans takes place in a closed cavity that the lips touch and soft palate close to the back of the tongue. Most chewing process occur in the posterior teeth, which is associated with canines in several ways. The tongue, lips, cheeks, and they manipulate food bullets, pushing them between the teeth continuously during lower jaw movement. The chewing habits is different between people to people. Some people have preferred chewing side where most chewing takes place, and some other people chew alternately, one side then the other side. Some chew on both sides at the same time. In your opinion, in which chewing habit is the most suitable? And why people have differences in chewing habits? There are some reasons for unilateral chewing that most of them are because of tooth pain or loss of tooth or tooth mobility, or it is just a habit. And some research show that there is an association between unilateral chewing and temporomandibular disorders. To be able to swallow, food must be crushed into appropriate degree during chewing to a food bolus. Thus, the chewing activity must be repeated cyclically and rhythmically, that we call chewing cycle. So, how does the chewing cycle work? The chewing includes the open and close activities. Its cycle has the teardrop shape, as you see in the figure, on the frontal plane and representing a power stroke. It includes opening and closing movements divided into three phases: the opening phase, crushing phase, and grinding phase, or also called the occluding phase. On the opening phase, from the intercuspal position, the jaw open about 16 to 18 mm, then move laterally toward chewing side about 5 to 6 mm. Then on crushing phase, the jaw closes. The lateral displacement decreases as the teeth approach each other. In posterior teeth, the buccal curves of lower teeth are almost directly below buccal curves of upper teeth, and the food is crushed. On grinding phase, the lower teeth contact with the upper teeth at buccal curves now, and then the lower teeth lie on the inclines of the upper buccal curves back to intercuspal position, and now grinding food occurs. Now, again to more details. This is intercuspal position. And on the opening phase, the jaw opens about 16 to 18 from the intercuspal position. Then it moves laterally toward chewing side, about 5 to 6 mm. After that, the jaw closes. The lateral displacement decreases as the teeth approach each other. And at this time, the buccal curves of lower teeth are almost directly below buccal curves of upper teeth, and the food between occlusal surfaces is crushed. Then, on the grinding phase, the lower teeth slide on the inclines of the upper buccal curves back to intercuspal position, so that at this phase, the food between occlusal surfaces is ground, or it also called the grinding food. I think rarely you do pay attention to how long it takes to complete a chewing cycle, because chewing is often an involuntary or automatic activity, so that many studies have calculated that the duration of chewing cycle takes about 0.6 to 1 second. The speed, duration, and shape of the chewing cycle varies according to the occlusal surface morphology, the food ties, and masticatory dysfunctions. At the intercuspal position, the mandible stops about 0.1 second before a new cycle, and the duration of tooth contact often takes about 0.2 seconds. When the food is initially introduced into the mouth, less contact occurs. But when the food is broken into smaller pieces, it will increase frequency in tooth contact. There are two types of tooth contacts, include the gliding contacts and single contacts. The gliding contact occurs when the slopes of the jaws lie over each other during the grinding phase and beginning of the opening phase. Single contact takes place at the maximal intercuspal position. We can observe the contacts in many ways. A common and popular way is to mark the occlusal contact with the articulating paper. This is a thin paper covered with colored wax. In this figure, you can see that we use red articulating paper to mark the sliding contact. This is the lateral side contact. And we can note that the sliding contact not necessarily on all the teeth. Several teeth no occur. The blue articulating paper is used to mark the single contact at intercuspal position. They are also endpoints of the chewing cycle. The change in shape of chewing cycle depends on the stage of food. If the food is harder and tougher, it is necessary to increase the amount of side shift movement, as well as increase the number of chewing strokes or cycles required. The occlusal surface morphology is also affected to the shape of chewing cycle. With the deep cuts or deep fossas, the chewing cycle is more vertical. But with worn or flat occlusal surface, they are required more horizontal cycle chewing to enable more efficient cutting and grinding of food. With normal people, the chewing cycle is round, repetitive, and well-defined. But the patient with jaw muscle or jaw pain, the chewing cycle are slow, stuttered, and less repetitive. There are also differences in the shape of chewing cycle between adults and children. The research showed that the functional movements in the primary teeth are performed in a more horizontal and anterior direction, and the lower level of lower jaw is less than in permanent teeth. About chewing force. The chewing force varies depending on many factors, but the average chewing force is about 7 to 15 kg for most food. It takes about 26.6 kg in posterior teeth, and during chewing, the greatest amount of force is applied on the first molars. And when food is tougher, the chewing takes place more on the first molars and the second premolars. The maximal chewing force varies according to individual. The maximal chewing force of male is greater than that of female, and the posterior teeth greater anterior teeth, accounting for about a third of posterior teeth. It also increases from infancy to adolescence, then decrease as you get older. The people who wearing the dentures have reduced chewing force compared to nature teeth. The chewing force of tough food may be much greater than the soft food, and the relationship between the maxilla and mandible that you can see here, the British face chewing force must be greater than that of dolicho face, because the relationship between maxillary and mandibular pole of the British face is nearly parallel compared to the normal and dolicho face. so that they have to make more horizontal chewing cycles as well as more chewing force to increase the effects of chewing. And with the patient who occur the pain in teeth or muscles or jaws, the force of chewing will decrease. To perform chewing activity, the coordinated participation of many muscles is required, including the jaw muscles, tongue muscles, facial muscles. In which of jaw muscels include the masseter muscles, the temporal muscles, medial pituitary, and lateral pituitary, as well as the suprahyoid muscles. Thus, chewing activity is performed with the participation of many muscles. The activities of the muscles need to coordinate with each other in an harmonious and rhythmic way, so the neural control of chewing then plays an important role in coordinating the activities of the muscles. How is the neural control of chewing? Let's answer the question. To produce precise mandibular movements, all of the information about the state of peripheral tissues must be transmitted to central nervous system via afferent nerve fibers. The brainstem and cerebral cortex integrate and evaluate these information to give an appropriate muscle coordinations. Then, through the efferent fibers to perform contraction of this muscle group and inhibition of other muscle groups to perform the smooth and precise functions. Thus, firstly, all of the information about the condition of peripheral tissue must be received completely and correctly from the peripheral sensory receptor, such as from the periodontal ligament, oral mucosas, lip, cheeks, tongue, muscles like jaw muscles and other muscles, and the temporomandibular joint. Each type of peripheral sensory receptor has its own function in receiving different stimuli. Then this information will be transmitted to the central nervous system through afferent neurons. The first afferent neurons transmit the sensory information from the orofacial region via trigeminal nerve. The cell body is located in the gaster ganglia. When the first afferent neuron enters the brainstem, it is synapsed with the second afferent nerves in the sensory nuclei of the fifth nerve. Then the second afferent nerve relay information to the higher center for interpretation and processing. At the central nervous system, the brainstem and cerebral cortex work together to evaluate incoming information. The cerebral cortex plays the main decisive role, while the brainstem in charge of the controlling the body normal subconscious functions like chewing, swallowing, breathing, etc. through central pattern generator, or it's also called the chewing center. The central pattern generator is governed by the central cortex, but it can also work independently of the cerebral cortex. The central pattern generator is a pool of neurons located in the reticular information. This is located in the medullary pontine and is used to generate the rhythmic chewing movements. This is called chewing reflexes. When central pattern generator is activated from the higher center and from the sensory information in periphery, it will create the final pattern of action, which determines the precise muscle coordination to perform specific function activity. When chewing pattern is effect, it will minimize damage to structures, so that pattern of activity is learned and memorized, which is called a muscle engram. The muscle engram is a set of muscle activities that are coordinated to perform a function without the subject's awareness, like a computer program located in the brain. And it is the result of process of learning when movements are performed and memorized. Memorizing the sequence of activities performed in the cerebral cortex were automatically performed in central pattern generator. When suddenly biting hard objects that the tooth is broken, it can trigger reflex response to stop chewing. The lower jaw adapts by moving to avoid contact with the damaged area. At that time, a new engram is memorized. The function just returns to normal only when tooth pain is treated. The information about chewing pattern is transmitted through afferent nerves to command the coordination of antagonistic muscle groups to perform specific function. The muscle involved in chewing activity are jaw, tongue, and facial muscles, which are controlled by nerves 5, 7, and 12 in brainstem. In summary about the chewing cycle, from the intercuspal position, the jaw opens about 16 to 18 mm, then moves laterally toward chewing side about 5 to 6 mm. The jaw closes at the lateral side until the buccal cuff of lower teeth is almost directly below buccal cuffs of the upper teeth, and in this phase, the food between occlusal surfaces is crushed. Then the lower teeth lie on the inclines of the upper buccal cuffs, back to intercuspal position, and grinding the food. About the activities of neuromuscular system. The informations come from the peripheral sensory receptors, like the periodontal ligament, oral mucosa, lip, cheek, tongue, muscles, and temporomandibular joint. All information is transmitted mainly to the trigeminal sensory nuclei in brainstem via the first afferent neurons. After entering the brainstem, the first afferent neurons synapse with the second afferent nerves in the sensory nuclei of the fifth nerve. Then, the second afferent nerve relay information to the higher centers, like to the chewing center pattern generator in medullary pointing and the cerebral cortex for interpretation and processing. The second afferent nerves also transmit information directly to trigeminal motor nuclei in brainstem. If they are muscle engram, the jaw muscle activities can be performed automatically through the motor nerves, which is called the jaw reflexes. At the higher center, the brainstem and cerebral cortex work together to evaluate incoming information. The activities of the central pattern generator determine the precise muscle coordination to generate the rhythmic chewing movement, which are called chewing reflexes. The central pattern generator itself is governed by the cerebral cortex, but can also work independently of the cerebral cortex. And the cerebral cortex itself can command the coordination of antagonistic muscle groups to perform the jaw muscle movements through the trigeminal motor nuclei in brainstem. So that's all for the lesson today, and I offer a few homeworks from here for you to review the lesson. Thank you for your watching. Hope to see you next time.